Hello, my friends. Welcome back to another masterclass at A Mind for All Seasons. I'm excited today to talk about this concept of neuroinflammation. In my opinion, this is one of the most widely misunderstood elements in neurology. And in things like brain fog or cognitive dysfunction or dementia or even depression, anxiety, mental health issues, Parkinson's disease, multiple sclerosis. I mean, I could go on and on and on and name all of these diagnoses and disorders. And really, these are elements of neuroinflammation. I want to talk about what that means, why people have neuroinflammation, and kind of define what we would do about it. So, first of all, I want you to read the subtitle of my presentation today. Any neurological or cognitive symptom is a sign of neurological dysfunction, or in this case, neuroinflammation. And that's what I'm going to talk through in my discussion today. Now, some of you may remember seeing this slide. This is a very comprehensive framework that I have utilized to work through the process of helping individuals that have neuroinflammation or neurological symptoms. I've taught lectures on this across the country. I've trained physician groups. I've trained nurse practitioners and PAs. I've spoken at licensing organizations and conferences. This is the framework. When people say, well, Randy, tell me what you do, here's what I do. Now, for our group and kind of the lay public, members of our program, the membership, this feels so overwhelming and so complex. So today I'm going to break it down and I'm only going to focus on this section right in the middle. Triggers of neurological dysfunction. So let me separate that out. Let me dial this back. Triggers of neurological dysfunction have a lot of different flavors or a lot of different types. Let me give you an example. Neurological dysfunction can be a cognitive problem. A cognitive problem is a reflection of how we think, like what's happening with our thought process. It's not a mental health issue, it's a cognitive issue. So, can you stay focused? Can you have good attention? Can you do math? Can you read and comprehend it? Can you memorize things? Do you have a good short term or a long term memory? This is what I mean by a cognitive problem. Okay. Other forms of neurological dysfunction might be behavioral health related. So this category references, do you feel sad? Do you have a mood disorder? Do you have anxiety? Do you have PTSD? Do you have schizophrenia? Do you hear voices? Do you see things that others don't see or hear, right? We call these in the United States psychological issues or behavioral health problems is kind of the politically correct word. It's a sign of neurological dysfunction. But there's still others. Look on the left-hand side of your screen to motor dysfunctions. Motor dysfunctions would be the inability to move very well. So this category includes things like Parkinson's disease or tremors, benign essential tremors, people whose head tremors. It's not just tremors, it's actually gait. I'm kind of a people watcher, having practiced medicine for 20 years. My wife and I just left the Nashville airport over the Labor Day weekend, and I would sit and watch people walk through the concourse. I would watch their gait. I can pick out neurological disorders with distinction, and it makes me want to go talk to people and find out, my goodness, tell me a little bit more about your gait. That sounds so dysfunctional, but when you practice medicine, you observe things, you see things, you train your eye. Um, Motor dysfunctions run rampant. That might include weakness in someone's inability to stand long term. Maybe that's a muscle function issue. That might correlate with motor dysfunction. The last category that I'm going to talk about, it's not the only other category, but it's the last primary category, is sensory disorders. This is how your physical body senses the environment around it. So, for example, do you have peripheral neuropathy? Right? Peripheral neuropathy would be I don't feel my legs very well, or I have numbness and tingling, or I get these zingy sensations. They really bother me. That's a sensory disorder. Other people might have pins and needles, or electric shock, or burning sensations. I've had many patients that say, Randy, I have burning tongue syndrome. If you've ever heard of that, it feels like their mouth is constantly on fire. That's how our brain senses the nerve endings in different parts of our body, usually the peripheral part of our body. So each of these represent different domains, if you will, or different elements of neurological dysfunction. And there's triggers of these, okay? That previous slide that I showed you, I'm going to go back to that slide. All of these are triggers of neurological dysfunction. So, for example, women can have a hot flash when they go through menopause and their hormones are off. That represents a sensory distortion. Other people can have a stroke. And when they have a stroke, they lose their ability to speak, or they might lose their ability to operate one side of their body. That's a motor dysfunction, right? Other people might have a concussion. And after a concussion, they have chronic vertigo, or they have ringing in their ears, or they get these palpitations and they can't stay focused long term, or they have light sensitivity. We call that photosensitivity, right? So these are all triggers of neurological dysfunction. And as I've talked to you just in the last 5 minutes, there's a lot of different categories of those neurological dysfunctions. When you work in the practice of medicine like I work, we can talk about triggers of neurological dysfunction and we separate them into these groups. So I already talked through this, but I'm going to reiterate these so they're easier to see. Now you can lay your eyes on them. Movement disorders, motor weakness, contractures, or foot drop. Some people walk and they drag their heels. They kind of shuffle along or scoot along. I've always thought benign essential tremors was a terrible name. I don't think they're benign. They're benign because we haven't been able to pin the tail on the donkey as to what causes them, but it's a manifestation of a neuroinflammatory process. Twitching, like muscle twitching. I had a lady many years ago that came to me because her eye just constantly twitched. It was one eye. It happened all the time. And I said, hey, your brain is inflamed. She said, oh, it doesn't feel inflamed. How do you know it's inflamed? Let's do some labs. Well, you can't really test that in lab work. I think I would get closer now than I could 10 years ago. But even then, it's kind of hard to test that. There's coordination issues. There's ataxia. I already talked about Parkinson's and Huntington's chorea. Sensory distortions. Again, these are things like peripheral neuropathy, numbness or tingling in your feet. Think of the diabetics that you've known in your life who got a sore on the bottom of their foot. They had a non-healing wound on their foot. Many of these individuals never felt it. If you knew how many times someone came to me and they said, Randy, I've got this bad sore on my foot. I didn't even know it was there until I took my shoes off and then I pulled my sock off and I had this huge blood stain on my sock. And I thought, well, where'd that come from? And I looked at my foot and I have this gaping hole in my foot I had no idea was there. That's a neuropathy. That's a sensory issue, right? Ringing in the ears. I took care of a firefighter for many years. I haven't seen him for a while. He moved, and so he's been lost to my follow-up. But he told me, Randy, it's like heavy machinery is operating nonstop, and I have this grinding and ringing in my ears that never goes away. So our entire focus when we took care of him was to try to figure out how to calm inflammation. Now, my belief is that alcohol was a part of that. When he was not working, he was drinking heavy, and I felt like that inflammatory response from alcohol was a likely contributor of neuroinflammation. Now, he felt like that wasn't the case because guess what? When he drank, he didn't have the ringing in his ears. And I said, dude, you're inebriated. You like calm down, you numb all your neurological functions, so that's not fair. Some people have chronic fatigue. They sense this lack of energy. I had one lady that came in one time and said, I feel like there's a pager in my back pocket. I have this vibration in my back that never stops. And I've often thought that complex pain syndromes or complex regional pain syndromes, these are sensory distortions in the brain. Behavioral health issues. I'm not going to spend a lot of time on these because these are very common. You guys recognize depression, anxiety, bipolar disease, hallucinations, delusions, or schizophrenia. We live in an area of pandemic proportion for attention deficit disorder and hyperactivity disorder. Isn't it fascinating? I hear people say, well, it's a smartphone problem. It's a social media problem. It's an electronic device problem. Well, I think those are likely contributors. Half the world lives their life in 60-second reels that they see on Facebook or Instagram. But I think it goes deeper than that. The autism disorder. I had this some good friends out of another state send me an email. I just got it yesterday. And in this email, they said, hey, my son's been diagnosed with autism. He has a follow-up, and the doctor did some labs. Would you look at these labs? And I said, well, I'll look at the labs, but I need more history. Tell me a little bit about your son. How old is he? How long has he had these symptoms? Tell me about his diet. Well, they sent me back the summary and they said, you know what? His diet is really good. He eats great. He is kind of picky, but he eats plenty of food. And they said, you know, he wakes up in the morning and has cold cereal. For lunchtime, he likes mac and cheese or top ramen. He likes those special corn dogs where they have a sausage in the middle wrapped up in pancake batter and deep fried. And as I read this, I was almost incredulous about this family equated his diet to calories that he was consuming. How many calories was he eating? And I think in terms of diet, not calories. No one in the United States starved to death. I mean, maybe there's places in the US where people are starving. We get plenty of calories, but the problem is the food is so nutrient deficient that I think it leads to some of these neurological disorders and neuroinflammatory disorders, especially in our kids that are growing up in a world of processed foods. Cognitive issues, I talked a little bit about this. This would be your ability to remember things, your verbal memory or your visual memory, your reaction time. Some people say my reflexes aren't very good. This is not going to sound very nice, and I don't mean any disrespect to seniors who have poor balance. But I remember walking with one of my family members, and they were older in age. Their balance wasn't very good. And while we were walking, they had a little trip, and it was almost like in slow motion. They were ahead of me, so I couldn't stop this. But I watched them leaning forward and their arms kind of clawing through the air, and they slowly lost their balance. And all I could think about was, oh my gosh, their reaction time is not very good. That's a problem of neuroinflammation and a neurological disorder. Some people have processing speed issues, meaning that when you're talking to them and you're having a conversation, they're equating and they're tracking you, but they just go slowly. You have to have a high degree of patience with them. And oftentimes that's a processing speed issue. There's executive functioning reasoning, sustained attention motor. I'm not going to go into all of them, but my point is to make sure that you understand when someone has a neurological disorder, a practitioner like me works hard to kind of look at the type of disorder, motor, sensory, mental or behavioral health, and cognitive dysfunction. And the interesting thing is, guys like me identify that treatment shares a common approach amongst all of these. We're kind of stuck in this mode of pharmaceutical medicine that says this medicine is for Parkinson's disease and that medicine is for Alzheimer's disease. And these mental health medicines are for depression, anxiety, bipolar, and schizophrenia. And my response to that is, my friends, each one of these neurological disorders share a common thread where there's an inflammatory response going on in the brain. The difference is the location of where that inflammatory response is going on. The location becomes a predictor of the neurological symptoms that that person might experience. So let's keep moving through this. Now you'll know that I view triggers of Alzheimer's disease or Parkinson's disease or major depressive disorder or multiple sclerosis or ringing in the ears, which would be tinnitus, or brain fog or memory loss or ADHD. All of these are forms of neurological dysfunction, and inflammation plays a role. So I go back to the beginning of my presentation and I ask you, how do you know if your brain is inflamed? And the response is because you have some form of a neurological disorder or some form of neurodysfunction. Now, if I could change the topic and give you another example, How do you know if your knee is inflamed? And it's because your knee doesn't function right. It either clicks or it pops or you don't have full range of motion. The function of that knee changes. Some of you might say, well, it gets red hot and it gets swollen. Yeah, that is a sign of inflammation. But oftentimes, loss of function is the primary predictor that something is inflamed. And that certainly is true when it comes to neurological disorders. Okay? So, this is a money slide. A money slide is something that you can't forget this. This plays a role. Neurological symptoms or a clinical symptom, like all of those symptoms I just described, are a great explanation that your brain is inflamed. Now, this is a good time for me to address this topic of headache. It's not uncommon when I ask people, how do you know if your brain is inflamed? They'll almost always say, well, you get a headache. Actually, that's not even close because there are no pain receptors in the brain. Your brain does not have a pain receptor. So neuroinflammation is not a manifestation of headache. A headache can come from a blood flow issue. It can come from tight muscles in the neck or in the scalp. It can come from the jaw. It can come from a lot of places, but that's different than a neurological symptom, right? That headache is a little bit different than the neurological symptoms that I just talked about. Notice when I talked about cognitive, motor, behavioral health, or sensory, I did not talk about pain as a symptom of neurological inflammation. Okay, so causes of neuroinflammation would then be anything that triggers the immune system, specifically the immune system in the brain. Now, our brain is not separated from the rest of the body. So when I say the brain's immune system, the brain immune system is actually part of the whole body's immune system. But there's a unique characteristic and nature to the immune system in the brain. And that's why I'm going to spend the next few minutes talking about this from a neurological standpoint. So first of all, the brain, the number of cells in the brain, let's just take the sheer number of cells. Most people, when they think of the brain, think that the brain is 100% neuron. Like our brain is made of nerves. It's a neurological system. But the reality is only 50% of your brain. On many estimates, it's only 10%. It's so fascinating. It depends on the part of the brain, or if I'm talking about the frontal lobe or the temporal lobe, or if I'm talking about the ocular system or the auditory system, right? The truth is the brain is split right down the middle between neurons that transmit a nerve impulse and then cells from your brain's immune system. So 50% neuron, 50% immune system. That's that whole of the brain. If I took a brain and I handed it to you and you held this brain in your hand, 50% of the weight of that brain might weigh, I don't know how many grams. Let's say it weighs 2 pounds, right? My brain might weigh 2 ounces. But if you were to weigh that brain, one half of the weight of that brain are cells from your immune system. Okay. And there's a crosstalk and a very dynamic balance that's happening. So when the immune system is calmed down and it's not responding to something, it's not irritated or revved up, the neurons actually function very well. But when the immune system of the brain gets fired up and they're angry and they're turned on, they're inflamed and they're active against something, the neurons don't work right. Now, inherently, this makes a lot of sense to you because when you get the flu, when you get influenza, that might be a respiratory problem, right? That's a pulmonary, a lung issue. But all you want to do is lay in bed and bright lights irritating and you want the sound down low and you just don't feel good. Your muscles are aching, your sensory is off, and you have no energy. You don't want to do anything. Think of that. It's because the cells in your brain are inflamed, and so the neurons don't work well. Another example that I can give you is when a senior citizen, we see this a lot in nursing homes and assisted living centers. When a senior citizen in an assisted living center has a change of behavior. They get angry. They start using foul language. They're cussing people out. They strike out. They hit. And it's very uncharacteristic. They don't do this before. Why are they doing it now? Oftentimes, those individuals who work in that setting will say, I think they have a urinary tract infection. So that infection downstairs in the bladder turns on the immune system all the way up the body into the brain, and all of a sudden that person loses their mind and they go mad. And it's because the immune system of the brain is on fire and it changes away the neurons' function. So now you know that it's not just all neuron. We've got to be thoughtful about the immune system of the brain. So when you walk away from my masterclass today, I want you to walk away and say, oh my gosh. So anything that activates my immune system, like irritable bowel or leaky gut or a wound on my backside, or if I get stung by a bee, if I eat terrible food. Think of this. The only thing you should feel after you eat is not hungry. If it puts you to sleep or you feel terrible fatigue, you've activated the immune cells in your brain and your neurons are just not going to function very well. Okay? So the nerve cells that I want to talk about the most, they're called right here, they're called microglia. Now, for those of you who look at blood counts or CBCs, you oftentimes hear about a monocyte. A monocyte is a first responder in your immune system. Well, when that monocyte is in the bloodstream circulating, it's a first responder. And when it migrates out of the bloodstream into the local tissue, when that happens in the brain, it's called microglia. The name changes. It takes on a little bit different personality and characteristic. An analogy that I would use is that I'm dressed one way now when I go to work. I'm wearing scrubs. I saw patients all day today in my primary care practice. I look like I'm practicing medicine. When I show up at the soccer field, I'm wearing a ball cap and shorts. I've got a whistle around my neck. I'm wearing my jersey. I look like a coach. When I go to church, I wear a white shirt and a tie, and I wear dress shoes, and I carry my scriptures, and I'm engaged in the work of the gospel. It's not that I'm a different person, but I have a different role in those settings. I'm still the same person. That's how microglia are. When they're in the bloodstream, they have a role as a first responder. When they migrate into the brain, they take on a different uniform and they're on constant surveillance. They're looking for anything that could cause inflammation in the brain. And when you light those suckers on fire, my goodness, you've got a problem. Next time I talk, I'm going to use an analogy and talk about what happens in microglia when they get primed, when they get ticked off or worked up. Okay? So if we back up now for a minute and we say, Randy, tell me the dynamic predictors of brain health. I really tried to simplify this so you would know. Look, if you want good brain health, you really need three components: your nerves and your immune system. So that's this upper portion here, your neurons and your immune system. They've got to be settled down and functioning and doing well. Okay. And then we've got to have blood flow. Blood flow to the brain is essential, and here's why. Blood flow nourishes the neurons and nourishes the immune system cell. Blood flow brings in micronutrients from your last meal. It brings in micronutrients from the supplements that you've been taking. Your blood flow delivers oxygen from your breathing, your dynamics. Blood flow also brings in hormones. So it brings estrogen, progesterone, testosterone, DHEA, pregnenolone, cortisol, epinephrine, norepinephrine, all of these hormones in the body that influence brain health. These are dynamic predictors. Okay, so now pay attention to this. On the left-hand side, you see this freeway system. I don't know where this is. I'm guessing it's Los Angeles or one of the big metropolitan cities, right? This blood flow is intertwined. It's weaving everywhere between these neurons. And then your immune system cells are in constant surveillance. They got these tentacles, like they're an octopus. They're reaching out. They're smelling the environment. They're like a Labrador dog. They're sniffing everything. They're tasting everything. They're trying to figure out, hey, is there E. coli in the brain? Is there a virus? Is there herpes simplex? Is there a tick bite? What's going on? And when that immune system gets activated, its job is to close things down. And then the neurons are firing nonstop, giving you daily function. It's helping you think clearly. It's helping your mental health. It's helping your motor function. It helps you run away or to go to sleep or so forth. So these are very dynamic predictors of brain health. And all of them have to be functioning in the best circumstances in order for you to have good brain health and avoid neuroinflammation. If you lose blood flow to the brain, your brain gets inflamed because there's no oxygen, there's no nutrients, there's no delivery of hormones. If the immune system gets activated, your brain feels like it has the flu. And if the neurons aren't functioning, you just don't transmit. You don't transmit neurological messages to the other neurons. Okay? In this slide, I've taken a diagram. This comes from Wikipedia. And in Wikipedia, now I've added the different parts of the brain. So there's colors there, right? Here's your frontal lobe, and in the blue is your parietal lobe, and in the pink is your temporal lobe. The green is your occipital lobe of the brain, and down here, this kind of purpley color is your cerebellum, and you get your brainstem. And then I've named them by their function. So the front part of the brain, this frontal lobe, is your thinking part. It's the CEO of your brain. You plan, you organize. It predicts your personality. Are you angry? What's your mood like? Do you feel anxiety? That's coming from this part of the brain. The back of the brain is your ocular function. This is where sight is. So your eyeballs are down here, and then you have this optic nerve that comes all the way back to the brain and coordinates with the back, the occipital lobe of your brain. So you can recognize people's faces. You go to church, you go to the grocery store, and you see your favorite teller at the grocery store, right? The favorite checkout clerk. And you smile, you recognize them. That's an image recognition. The way you perceive the world comes from the back of your brain in terms of eyesight. On the upper part of the brain, up here in the parietal lobe, this is your motor function. You know, this is so fascinating. The way we figured this out is they did studies with individuals who were they were in surgery, and they would drill a hole in the brain and they would touch their brain with a probe, and they would say, this is very rudimentary. It's much more scientific than what I'm explaining. But they would touch an area of the brain and they say, where do you feel that? Oh, I feel that in my thumb. Well, where do you feel that? Oh, I feel that on my foot. Well, they're touching the brain right here in this sensory lobe. And so that's where they say, wow, the sensory function of the brain is right here in this area. So maybe neuropathy plays a role in the basal ganglia of the sensory function. The motor function is how we move our hand, how we move our wrist, kind of those relays about how our motor function works. Speech is right down here. This is a common area for an individual to have a stroke. And if they have a stroke, it affects the speech, the ability to speak. And that could be both spoken language or receptive language. Sometimes we talk to people and they don't receive it. They don't understand because the receptive area, that's called Wernicke's area, gets impaired. The temporal lobe is memory, your emotions, your short-term memory, your long-term memory. This is the area that gets impaired when we get dementia. Your hearing area here, your muscle sensation, coordination, posture, and balance. Parkinson's disease patients have inflammation in this cerebellar part of the brain, this dark purple at the very base of the brain, right? That's the cerebellum. That's where all the motor coordination is really coming from. So my point to this slide is to say, look, we talk about the brain like it's one organ, but the reality is the brain has several different departments. When you go to the grocery store, you have a produce department, you have a meat department, a butcher's area, you have a bakery, you've got baking goods, you have a pharmacy, you have all these different areas. That's how the brain is. Each one of these areas serve a different function. So the location of inflammation in the brain is a predictor of the symptom that you might experience when the brain gets inflamed. So let's take this thinking part of the brain right here, this frontal lobe. And I'm going to give you an example of this. When this frontal lobe gets inflamed, Individuals, it's like the CEO goes to sleep. They can't think clearly, they can't concentrate, their mood, their personality, it just goes downhill. So whenever I see someone that has major depression, I'm thinking something's going wrong in the front portion of their brain. Maybe it's a blood flow issue. Maybe it's a nutrient or a hormone issue. Maybe it's a chronic inflammatory response. I'll give you an example of that. When they have ringing in the ears, it's this temporal lobe that's probably inflamed. So again, remember, the location of the inflammation in the brain in large part becomes a predictor of the symptoms that an individual feels. And so, if we go back to that front part of the brain fog, mental fatigue, depression, anxiety, apathy, poor focus, and a bad social filter, we've all been around individuals that you can't believe what comes out of their mouth, right? They'll be walking and they'll say, "Oh my gosh, look how ugly that lady's dress is." And they say it loud, and you're thinking, "Oh, but you can't talk like that." Well, they don't realize it. They've lost that social filter. That's an inflammatory response in the frontal part of the brain. Sometimes, if it's dementia related, we call it frontotemporal lobe dementias. Okay? So, what causes your brain to become inflamed? This paper, if you look at the very bottom of my screen, this was a paper called Aging, Microglia Cell Priming, and the Discordant Central Inflammatory Response to Signals in the Peripheral Immune System. You guys hear that and you just roll your eyes and think, how boring is that? That put me to sleep. I spent hours reading and studying this info, and this is how fascinating it was. I've named these the different areas. So this slide comes from the paper and I put the numbers on. Brain inflammation can come because inflammatory markers diffuse into the brain. That's number one. Number two, inflammatory markers can be transported into the brain, right? We transport them through a process of our immune system. Number three, they can come from our liver. They can come from our GI tract. Those are called vagal afferent transporters, and they can also be neural. So again, that still feels very clinical, and it may not mean anything to you, but I'm going to walk you through this. Let me say this in very non-clinical terms, okay? The first one is diffusion. You remember during COVID, there was talk about a cytokine storm. When the immune system got revved up, these inflammatory cytokines would get transmitted to the brain, and it was called cytokine storming. Well, those cytokines travel through the bloodstream and they just kind of cross the blood-brain barrier. They actively diffuse through our our cerebral spinal fluid and our blood vessels. And in this paper, the argument, it was mostly the cytokines of interleukin 6 and tumor necrosis factor alpha. Okay, so these two top areas, when diffusion and transportation happen, it's because we have inflammation that's happening systemically in our body. So any systemic inflammatory process, like a urinary tract infection, or a cold sore, or pneumonia, or open wound, or a dental infection, these cytokines get transmitted into the brain through active diffusion or through transportation and cause our brain to become inflamed. The next one is vagal down here. This comes from gut inflammation. So you got a leaky gut, you have a leaky blood-brain barrier. Well, how do you know if you have leaky gut? It can come from food irritants and intolerances. Maybe you don't tolerate milk very well. Milk makes you sick. Guess what? Milk can inflame your brain because when the gut gets inflamed, that's transmitted to the brain. It can be C. diff. Let's say that you get on antibiotics for strep throat and then you end up with diarrhea and they test you and you have C. diff. Boy, that just wreaks hell on the brain, right? Terrible gut inflammation leads to neuroinflammation. Individuals can have SIBO or irritable bowel or inflammatory bowel disease, diarrhea, constipation, and so forth. Many of our clients, I have one client, they may be participating today, I'm not going to give it away, but many of our clients have told me, Randy, my brain function tracks with my constipation. When I feel terribly constipated, I don't think very clearly. And we have a hard time helping them get brain clarity until we can get their gut working correctly. And I'll admit, sometimes it's actually very difficult. The last one is the blood-brain barrier gets disrupted. And the most common reason for that to happen is a traumatic brain injury or a concussion. Even head injuries of very modest or mild intensity can actually change the blood-brain barrier and lead to neuroinflammation. So here's the million-dollar question of the day. How do you know if you have neuroinflammation? Or what are the symptoms of neuroinflammation? Neuroinflammation, again, is not a headache. Headaches are likely a vascular, a muscular, a muscle tightening phenomenon. The way you know is you have a systemic inflammatory response that is transmitted to the brain. I want to give you one of the most classic examples of this. I had a 20-year-old college student that came to our service, and she had the most horrific depression, major depressive disorder. There had been 2 attempted suicides. Her father was so anxious to try to help her, and he brought her to our service thinking, well, I know you guys have a unique approach. See if you can do something to help. She'd seen multiple psychiatrists. She had been on multiple courses of medicine, right? Multiple antidepressants, antipsychotics, mood stabilizers, bipolar medicines, you name it. She'd been on all of it. Well, her father was a dentist and he was very open-minded to integrative medicine. So he thought, my gosh, we've tried the very best of pharmaceutical medicine and it just hasn't made a difference. What else might be missing? So I did my standard workup. We did the enhanced protocol. I drew a bunch of labs, I looked at nutrient levels, and I initiated therapy. And in the early stages, she did really good. She had some intermittent success. She goes back to college and she said, Randy, um, my depression is back. I just want to kill myself. This is terrible. Suicidal thinking, can't get out of bed. It was like she had the flu. And she's like, I slept in this morning. I missed all my classes. That's not like me. Something's wrong. And so I went back to, well, are you taking fish oil? Are you taking the, and she got angry with me. She's ticked off. She's like, I'm doing everything you asked me to do. I haven't stopped doing anything. And I realized, okay, we're missing something. What's happening? And she said, Randy, I'm doing everything you asked. The only thing that's different is I've got this pesky cold sore. And I said, what? I'm on a telemedicine call with her. So we're looking at each other on the screen. And I'm like, I don't see it. She goes, no, you can't see it. Remember, my dad's a dentist. So my dad gives me some medicine. When I feel that coming on, I just take a little bit of medicine and it never erupts like a terrible cold sore. But my lip is so sore, I can feel it. It's tender. It's there. It sucks. I hate this. And I said, oh my gosh, that's the cause. Remember, neuroinflammation is caused by some sort of systemic thing. So she had this inflammatory response in her lip. Now she's like, that's stupid. And I said, well, how often do you get cold sores? She says, I get them all the time. My gosh, I get them every month. She says, sometimes it never goes away. And I'm so grateful that my dad can prescribe this medicine for me because he gives me enough medicine that I can keep it at bay and you can't see it. But my gosh, it's always there. And I said, that's it. That is the cause of your neuroinflammation. It's coming from that cold sore. And I had to show her this picture. Okay. This nerve right here is called the trigeminal nerve. Tri means 3 because there's 3 branches to that nerve. This middle branch travels right down to the lip, this upper lip right here. This lower branch innervates the jaw and the lower lip. Okay. So that cold sore is stimulating and inflaming the trigeminal nerve. And you see these 2 lower branches. But what she didn't realize is the 3rd branch of the trigeminal nerve goes right up into her frontal lobe, her brain. And remember that slide I showed you, the frontal part of your brain manages your mood. So I told her, every time you get this frickin' cold sore, you mount this terrible inflammatory response that travels up the trigeminal nerve into this branch that goes up into your frontal lobe. and it lights the front of your brain on fire. It stimulates all those immune system cells that we just talked about, and the nerves don't work correctly. Now you can't release neurotransmitters, and serotonin and dopamine drop, and norepinephrine and epinephrine get screwed up, and acetylcholine and glutamine. It's a disaster. And I said, how much of that antiviral cold sore medicine do you have? She goes, I don't know. I have 20 or 30 tablets. And I said, I want you to take it 2 times a day for the next year. Every single day you take it, whether you have a cold sore or not, because that medicine has been shown to calm a viral infection. She said, well, I have enough. And I said, I'll call it in for you. So we called it in. I checked with her in a couple of days, then in a couple of weeks, then in a couple of months. I'm happy to tell you this young lady has graduated from college. She got married. I think she's pregnant now. Maybe she's had a baby. I haven't talked to her since. And her mental health is infinitely better than it was. She actually was so enthralled with what she learned. She now works for a brain recovery clinic in a distant city from us. She works with head injury patients. She's so inspired by the fact that we helped her identify this cause of neuroinflammation. She wanted to understand more. So now she's the general manager of a large practice taking care of people with a head injury. Isn't that a cool story? Now, it's tragic that for years she suffered with major depression. But we were able to overcome that when we calmed that neuroinflammatory response from the cold sore. And we went through a whole bunch of nutritional supplements to calm that viral infection, some natural antibiotics, some natural antivirals, some calming agents like omega-3s, and we used prescription antiviral medicine to make that difference. Why? Because that frontal lobe is what drives mood disorders, anxiety, and major depression. So, illnesses and symptoms that are related to neuroinflammation include everything we've talked about: major depressive disorder, anxiety, people who have balance issue or tics. You've heard of Tourette syndrome, right? Tics and tremors, spectrum disorders, this whole this autism spectrum disorder, it has my mind boggled. I'm always thinking about it because in some states in our country, 1 in 13 kids are diagnosed on the spectrum for autism. My friends, I went to grade school 30 to 40 years ago. I don't remember an autistic kid in my class. Now, maybe there was children with autism and I'm just a dork and I didn't recognize it, but it's everywhere. We see it. There's something going on that's driving that neuroinflammation, multiple sclerosis, brain fog, attention deficit disorder, ADHD, people who have ataxia. Now, Dr. Karazian wrote a book, Why Isn't My Brain Working? And one thing I really liked about his book is he said your symptoms of neuroinflammation, symptoms of neuroinflammation, I speak because I got allergies right now, can be mild and transient. These would be things that don't last forever. So this would be kind of this brain fog spectrum, slow, hazy processing speed, or I don't have good recall, or my speech isn't very clear. Our brain endurance drops. We just get fatigued really easy. It can happen with chemical sensitivities in our home, right? It can happen when we go fill up the gas tank and we take a big whiff of that petroleum that's going into our car. These can be mild and transient. We get a little bit more severe, and the medical literature, instead of naming it with a diagnosis, the medical literature says, hey, this is a sickness behavior syndrome. And the research community calls it sickness behavior syndrome. The medical community gives it a diagnosis. So that's when we say, well, that's depression, or that's attention deficit disorder, or that's chronic fatigue or post-traumatic stress disorder. That's chronic insomnia or dysmotivation syndrome or chronic tinnitus and ringing in the ears. When it gets really severe, kind of this Dr. Jekyll, Mr. Hyde, it becomes more permanent. This is where we see things like dementia or delirium or chronic disorientation. Our assisted living residents can have a Dr. Jekyll, Mr. Hyde. They can be so sweet one day, but they're sweet and impaired, right? Because this is a chronic progressive problem. and they're sweet and impaired, and then they get inflamed and now they're not sweet anymore. They're impaired and angry and ticked off, and they're beating people up and biting and kicking and yelling and swearing, and they're angry, right? That's where this behavior disorder comes from. So what we want to do is recognize in the early stages, the earlier we address this, it can be reversible. We can recognize that inflammatory response, like the young lady I just told you about that got cold sores. When we got aggressive in treating those, it went away. The depression went away. The earlier we intervene, the more likely we are to reverse it so that there's no permanent damage. But oftentimes, early intervention in chronic illnesses doesn't promote reversibility. Symptoms persist. They go on forever. We can't 100% reverse them. Why? Because maybe the neuron has died. Maybe that immune system has become primed. That's another discussion. So our goal in these chronic, progressive, angry, perpetually impaired individual, the goal is to do everything possible to calm that inflammation so we don't have to use antipsychotic medication, because then we're just asking for more trouble. So we engage a process to both identify and calm neuroinflammation or neuroautoimmunity. Okay. So on the far left-hand side, those early symptoms often improve with lifestyle. If we can get people eating better, if they can exercise, if they get better sleep, if they take care of their dental health, these symptoms make a huge difference. But part of our goal, part of my goal, is to work to identify major triggers, stressors, lack of sleep, chronic infections, terrible diets, GI health, post-concussive syndrome, sleep apnea or prolonged hypoxia, increased blood sugar in a diabetic, or long-term smokers, or menopausal women who don't have their hormones. These are the things that we focus on to try to calm. Even if they have long-term impairment, I think we can still improve quality of life through some of these interventions. Okay. So I've maxed out my time today. I have so much more that I could share on this topic, but I want to open it up for some questions that you might have specifically about neuroinflammation. Ask yourself this question while you're posting your questions in the chat, or you're thinking about, do I dare ask something that's kind of scary and embarrassing? I would ask you this: what is happening in your life that could lead to an inflammatory response, inflammation that goes to your brain and gives you brain fog? Is it your gut health? Is it your diet? Do you snore like a chainsaw and it might be a little bit of sleep apnea? Do you get chronic cold sores or infections like the girl that I talked to you about? Do you get urinary tract infections? Do you have a micronutrient deficiency like a vitamin B1 or B9 or B12 or omega-3 or vitamin D? Right? You see my point. That's when we go back to those triggers and we say, if we improve these triggers, can we improve the symptoms that are being driven by neuroinflammation? And with that, I'll open it up for some questions and some discussion.